Your unique combination of expertise, your desire to drive change, and even your frustration with current systems are not burdens. They're signs pointing you toward your greater purpose. Greetings, everyone, and thank you for joining me on this episode. Welcome to Public Health Entrepreneurs, the podcast for visionary leaders who are ready to transform public health and healthcare through innovation. I'm your host, Dr. Charlotte Huntley, and as a public health entrepreneur with over 25 years of experience in healthcare and public health, I understand the unique challenges and opportunities that come with bridging multiple disciplines. In this episode, I'm sharing some actionable steps for your journey to create greater impact. Today marks the beginning of your journey to create greater impact in public health. Your unique combination of expertise, your desire to drive change, and even your frustration with current systems are not burdens. They're signs pointing you toward your greater purpose. As you listen to this podcast, give yourself permission to dream bigger, to see yourself as the innovator you truly are, and to recognize that your diverse perspectives are exactly what is needed right now. Let's start with some reflection questions. Now, I recommend making note of these questions, then spending a few moments crafting a response later. Be honest with yourself. I'm not going to ask you to submit this to me as if it's an assignment, but this is designed to help you. So be honest with yourself as you sit and reflect and prepare your responses to the following questions. So number one, what health-related change have you been wanting to create? You know the answers to these. Like I said, don't hold yourself back if you hesitate on some of these questions. They may even feel a little uncomfortable to articulate and get them out of your head onto a piece of paper or typed into a document, but I really encourage you to do so. Number two, how might your unique background position you to drive innovation? Number three, what could be possible if you had the right support and community? I can just imagine some of the feelings that are coming up for a few of you who have really not allowed yourself to explore responses to these questions, but I really encourage you to do so. Number four, what's the cost of not pursuing your vision? That one, well, every time I think about that question, I think about our mastermind group. When we have our retreats, we often talk about this. It's a concept and a phrase I say often where it's bigger than me. You know, we have to get out of our own way. As public health professionals, we are serving populations of people. So when you think about the ideas that you have, they're not for you, they're for serving someone else. So what is the cost of not pursuing your vision? And number five is who could benefit from the solutions you envision? I want you to take some time, like I said, reflect over those questions and take as much time or as little time as you like, but they're reflection questions for you. So after you've taken some time to reflect over those questions, here are some action steps. Number one, vision capture. Write down your biggest dreams for public health transformation. I like writing them down because there's something about pen and paper that it's old fashioned now, but it's something magical about putting pen to paper when you're dream casting and putting your thoughts out. But you can certainly open up a spreadsheet or a document and just put it together. But write down your biggest dreams for public health transformation. List the unique perspectives that you bring. And then identify one gap that you're passionate about addressing. And I know there are a lot of them, especially the audience that I'm speaking to. You know what the gaps are. You've worked in the industry, you are aware of them, and there are a lot. It may be, I won't go down a rabbit trail, but it could be a community that you care deeply about not having access to resources or specific resources that other communities have. And you see that some programs are missing or they're inadequately serving this community that you care about. It is an example of a gap. You know what they are. It's just, I'd like for you to identify one that you're really passionate about addressing. It doesn't mean the others aren't important. Just identify one that really rises up for you. And then note what's held you back until now. Like what has prevented you from doing anything about it up until this point. Be honest with yourself. It's important. All right. Number two, under these action items, readiness assessment. I want you to conduct a readiness assessment. I'd like for you to rate your current satisfaction with your impact. In other words, how happy are you now with the current level of impact or current amount of impact you're able to have on the community that you care much about? This is not a judgment, because if you're feeling like, oh, I haven't done anything yet and I really want to, this is not. I just want you to rate your current satisfaction with your impact. You're having some impact, so don't discredit that, but be honest with yourself. How happy are you with that? Rate your current satisfaction with your impact, or rate your, yes, that's current satisfaction. So where you are now with that. And then list available resources and support. What is available to you, whether you're taking advantage of it or not? What is available to you? What resources and support is available to you? Identify what you need to move forward. It's an important one. And set initial goals for your journey. Just those initial goals. If you've gotten started, like whatever the next step would be for you. That's the readiness assessment. And then finally, the third action step I have for you is commitment setting. So choose one step to take action on this week. It can be big or small, but just choose one step that you can take this week. Schedule dedicated time for your development. For a lot of you, like me, I value that time. So if I mark that time off for that thing, it usually happens. So schedule dedicated time for your development. And I still continue with this commitment setting. Identify one person to share your vision with. One person, trusted person to share your vision with. And then plan how you will engage with this podcast content. You've heard me talk about how we're leveling up, and you may be brand new to the podcast. You may have been listening for a while, and you've noticed over the last few episodes, I've talked quite a bit about how we're leveling up and how we're shifting. I've made that slow and intentional because I want you to know the change is coming. Well, we're here now in it. So plan how you're going to engage with this content. Are you going to get a separate dedicated notebook for the podcast, which I recommend, or maybe whether it's a digital notebook, open a new workbook or a separate document and have a space to capture the notes that are going to be coming from these episodes. Maybe you will designate some time to listen to these episodes, to consume and keep up with them, but plan how you will engage with this podcast content. All right. So I've given you some reflection questions and then some action steps to take after you've gone through that. Continuing with this podcast is going to be a valuable resource for all of you. But are you ready to fully explore what's possible for your vision? As a public health entrepreneur who works with high-functioning interdisciplinary leaders, I provide the trusted soundboard that you may be looking for. Feel free to reach out to me through our website to explore options for working together more closely. There are limited options, but there are options. And our website, by the way, is publichealthentrepreneurs.com. All right, everyone. Until next time, have a fantastic rest of your day.